Hello, colleagues. My name is Andra Davis. I'm an associate professor at the University of Portland School of Nursing and ELNEC co-investigator with Dr. Farrell through a Cambia Health-funded grant to advance palliative care education and strengthen the nursing workforce in caring for people with serious illness and their families. A major part of that work is to facilitate networking and co-creating a regional model of excellence in palliative care education, and particular focus in a region where I work and live, Washington, Oregon, Idaho, and Utah. And we are so very lucky in our faculty spotlight today to welcome and hear from Dr. Shillam, who is my dean. She is dean and professor at the School of Nursing at University of Portland, where she's been for, well, since 2006. Dr. Shillam is a seasoned educator, having taught across many courses in the undergraduate and graduate level, and she's well-versed in issues around accreditation, well, from the perspective of a faculty member, but also as a dean. Her research interests are varied and have included palliative care, and she recently concluded a really amazing project funded by the Rita and Alex Hillman Foundation to implement primary palliative care into a nurse-managed clinic serving the houseless population in the Portland area. Of particular interest on this spotlight today for our listeners may be, Dr. Shillam, that you also served as a member of the Essentials Task Force, and so you bring multiple lenses, if you will, to this conversation around this sphere of care, which I'm going to change slides here and remind folks the essentials that came out last year have 4 spheres of care, and the one that we're really focused here in on is hospice, palliative, and supportive care. And so with that, I would love to turn it over to you. We're going to kind of focus in a couple of primary areas to get your perspective during this short interview. And if you could maybe start by sharing with us some ideas around just your general feelings and reactions to this idea of hospice, palliative, and supportive care getting a seat at the table.
I can share my thoughts. Thank you so much for having me here. And I think that the idea that this is designated as one of the 4 spheres of care that all nurses need to be prepared in having competency is a remarkable advancement for our profession. I really believe that so much of what we do is symptom management as nurses. And when we think about it in the context of a framework of palliative care, it really helps learners understand the reason why they need to be skilled in those competencies. So I think it's a remarkable advancement for our profession that it truly is identified as one of the 4 key areas that all nurses need to have that skill. And I also really appreciate that we were able to bring that into both the level 1 and level 2 competencies and subcompetencies, because that's also indicating this clear value that we have that all BSN and advanced practice, advanced educators, all sectors of the profession need to have that competency. So I think it's a pretty exciting time in our profession.
And especially for those of us that have really seen the value of this for many, many years, to have it recognized and to really feel a little more confident that we're preparing nurses to go out there and provide good quality care for people with chronic illness, serious illness, and their families. We would, one of the questions that I have is, we know that schools are at various stages of development in terms of having maybe faculty with or without palliative care expertise as we sort of move into examining, schools move into examining this component of their curriculum. Intentional integration of across curriculum or not, or casual, less formal, and so forth. So with your educator hat on, what are some of your thoughts for the listeners who may need some more guidance about integrating this and this whole sphere of care in their program. And you can share generally, or if you would like, what's happening at University of Portland.
Most definitely. And I think that's one of the really great things about what ELNEC has done is it's created not just a toolbox of all kinds of resources for us to use, but it's also supporting, along with AACN, this collaboration, this networking. And truly, any kind of a curricular revision, it is not an independent journey. It is best done in collaboration and partnership with others. So I feel that this network, this regional network that you're leading, and the work of ELNEC and AACN, it is about disseminating and sharing and supporting one another. So palliative care can be perceived as such a niche specialty area that people don't identify that what they do really is palliative care. As I started when we talked, stated when we first started talking, that so much of what we do as nurses is symptom management, and that is one of the core underpinnings of palliative care. And recognizing that palliative care happens in all settings across the lifespan, across the whole care continuum, I think that's the first place that educators can really help identify where they might be able to start embedding some of this palliative care and hospice and end-of-life care into their programs. But I also think that having these tools is really important. Being able to share the CARES document, the G-CARES document, those are documents that help educators understand what are the competencies, how can they be threaded, and then how do we evaluate competency? I think that's another really big goal that we have to achieve in this revision of how we look at nursing education. And one of the most revolutionary things that I think we've done in the history of nursing education is we really are transforming away from this idea that students need to have an arbitrary number of hours in a setting, and that is going to make them a competent nurse, versus what we're doing now, which is being able to evaluate competency. And so using these documents and using these resources and using these tools that we have, that is going to help all nurse educators get to the place where they understand really what is palliative care, what is a competency, and then how do you measure that and evaluate that in students over time throughout their program.
Thank you. For those of you that may not be familiar, the CARES and G-CARES documents came out, I want to say 2016 and forward. And they really are guiding competency statements. So it is, the thing I was thinking about listening to that is that it also could serve as grounding for folks that may not really be familiar with what that looks like. So faculty that are new to this realm, and sort of how we describe the main competencies, if you will, the constructs in primary palliative care. Those are very helpful documents, and you can find them on the ELNEC website if you're not familiar, to our listeners. So I wanted to expand just a little bit more. You touched on this idea of moving towards competency-based evaluation. Do you have some thoughts? Because that's really quite new and different for schools. Well, not all schools, but it's a new direction for many schools. As you said, we don't necessarily know that being in a particular setting means that someone's competent. So do you have any more thoughts about how schools might begin?
I do. I know. So AACN is providing an entire series of webinars on competency-based education, evaluation, strategies for teaching and learning in competency-based education. But I think that, for our conversation here, I want people to really understand that the most important shift in preparing to move to evaluating competency is understanding, I think, three important factors that are really hard for us in nursing education to wrap our heads around. And the first is that a competency is not simply a one moment in time checklist. So we know that we love and value our skills checklists, or saying, yes, the student did perform this psychomotor skill in a clinical, so therefore check, it's done. Competency is not about a checklist. The second is that competency builds over the course of a semester or a quarter within the individual courses, but it also is developed over the entire program of study. And so those are the other 2 points that I think we really are going to have to make some really big shifts in how we deliver education. So thinking about how a student comes into a course, how do we create learning opportunities for them to identify ways of thinking and making connections within a course, and how that builds over the period of that course itself. That is one level of building and demonstrating and evaluating competency. But then also, how do we do that over the course of the whole program of study? And so those are very different types of learning opportunities. We can no longer use the strategies we've used before of being a sage on the stage, or delivering a lot of content to students or talking at them and then expecting that they just take it all in and then regurgitate it back out, whether that's on a paper or an examination. It really is much more about interactive learning opportunities and activities where students can learn from a case study, and maybe they're learning about a specific concept. In palliative care in particular, they might be learning about, maybe it's the physiology or the pathophysiology, then they learn about a case, but then they have to take that learning all the way through to delivering care, making decisions about interventions, understanding how to evaluate those, and then demonstrating their reasoning for understanding how they got to that point. So it isn't, again, about just, oh, yes, they administered this medication, or they changed this dressing, or they did this assessment, but understanding how they develop their clinical reasoning skill over time. So it is a really big shift in how we are teaching, but I think that nurse educators already have been doing many of these things in pockets, right? We know that case-based learning has been very effective. Concept-based education has been really effective. So there's a lot of things that we do, but now it's just bringing it all together in really one big package.
Yeah, I really appreciate that idea of sort of longitudinal development. And it reminds me, I think we have just a couple more minutes. If you wouldn't mind sharing how University of Portland actually has done that, at least in the undergraduate program, beginning with a theology course where this idea of palliative care was introduced.
Absolutely. Yeah. So we did go through a major curriculum revision, and we have now really embedded those 4 spheres of care as the foundation of our program of study for the BSN program. And it is threaded not only through the nursing courses, but as you mentioned, through our Theology 348 course, which is called Suffering and Death. And that's where our professors from theology partner with nursing professors and help students understand how to support people as they're going through the palliative care stages or phases, and actually wind up going into end of life care, what that means for caring for the family members and not just the patient. And so that does help set a foundation and framework that they then are able to take into their population health and wellness course, so that they understand, when we think about populations and promoting health and wellness, it goes beyond the health part of keeping communities healthy. It also means helping to support the health and wellness of people as they age or as they progress through serious illness. And how do we think about taking care of caregivers for those who are caring for people with serious illness as well? So it's just really helped us to frame this idea of palliative care is embedded into the entire program of study. And so when we think about, when we make that transition from where people are living in communities to then acute illness, regenerative management, then into chronic illness, and then into that palliative and end of life care, it's a continuum, but it's also a place where we recognize palliative care happens in all of those sectors.
Beautiful. And what a nice illustration of the developmental process, particularly around palliative care, that starts very early and then at UP ends, well, it doesn't end, but culminates through a simulation, an unfolding simulation case for seniors. So where they hopefully can apply a lot of that they have brought along and be able to demonstrate how they got there and explain that. So I think that we have just another minute, and if you have anything else that you would like to share with us, it would be wonderful. So
I just appreciate the time to be here with you today and want to just share my excitement and my enthusiasm and my hope. I really feel like this is going to be a time that nursing education advances further and faster than we ever have before. And we now have so many resources to help us. And we now have communities that are being built to help support each other through this process.
Thank you. And just to circle back to the resources and the support, one of the things that we are hoping to do through these faculty spotlights and other regional workshops that we're having and webinars is to do exactly that, to let's not reinvent the wheel, let's dive in this together and see how we can help each other, as well as going to ACN website for their abundant resources as well, and the ELNEC website, which actually has a faculty educator corner for nurse faculty now. So we are growing that whole section and hope to have, this is where this spotlight will live, and other resources where schools are sharing examples of teaching strategies they've done, different ways that they have evaluated student learning and so forth. So thank you for being here, and thank you to the listeners as well.